Welcome back to the Shame on Stigma podcast, where we have honest conversations that break down barriers, challenge harmful narratives, and shine light on the truth about substance use disorder. I'm your host, Carrie Ann, and today we're diving into something that is close to the heart of our work, reducing stigma through outreach and education. With me today are some incredible nurses from our public health team who recently led our business outreach program, bringing overdose education, Narcan training, and compassionate conversations directly into our local workplaces. First off, thank you all for joining me.
Thanks for having us. Thank you. Glad to be here. I'm Denise.
And I'm Karen. I'm a registered nurse. We're both registered nurses, and we are working with the city of Revere currently on a business-to-business naloxone initiative that has been going really well.
Wonderful. Thank you, ladies, so much for being here today. You know, these group of nurses, Atlantic Hill Nursing, we'll make sure we let people know who you are.
Yeah.
They have led our initiative of going business to business.
Yeah, I can tell you a little bit about the program and how we got started. So in January of 2025, Atlantic Hill Nursing and Wellness, we are an agency working in Massachusetts, and we do a lot of work with opioid prevention, harm reduction, community services, and public health programs. So we connected with Carrie Ann from Revere, and we knew we needed to initiate something together. So we immediately began planning, and what Revere had in mind was this business-to-business initiative. So we call it our Neighborhood Naloxone Rescue Project, and basically what that looks like is we are trying to fill the gap between, Narcan availability in the community. So what that looks like is we go really on foot, door to door, visiting local businesses, interacting with business owners, employees, and just offering education, reducing stigma, providing them with the knowledge they need to reverse an overdose, and trying to empower our communities. So really we go business to business, offer a kit and a training, answer any questions that they might have, and it's been very well received so far.
That's amazing. Thank you, ladies. That brings me to my next question about stigma. I'm sure in your outreach you've encountered some hesitation or misconceptions. What kind of stigma did you see?
So I guess I could speak to that. I think mostly it's people not understanding kind of what Narcan is and what it can do, and also kind of reducing that well, I don't know anyone who does drugs, so we don't need that here, So we try to just educate. Like if somebody says, no, we're not interested, we don't need that here. I would say 99% of the time we have that conversation with the business. We're able to explain to them what this is actually for, and that, it can happen anywhere to anyone at any place at any time. Yeah. And, wouldn't you like to be prepared if you had somebody in your business that, overdosed for some reason? And a lot of people will say, well, we'll just call 911. And that's kind of where we educate how they may not make it in time. Right. These things can happen very quickly. And this one little thing could save somebody's life or, get them to the point where EMS arrives.
Yeah. And I think it's important with the stigma too. It wasn't, anything hateful or negative that we were facing. It was just misconceptions and misunderstandings just like that I will keep a hands-off approach. I don't want to get involved. It was not really rooted in judgment, more so just not knowing how to react and what's the best way to respond in an overdose situation. And I think a lot of what we were able to do, too, was educate the people we came in contact with. A lot of people, like Denise said, oh, well, nobody here uses fentanyl or heroin recreationally. So a lot of this project was educating about, the teenager who might have bought a pill off the street that doesn't know that what they think is Xanax is laced with fentanyl. And having conversations like that in real time, we saw many parents say, oh, I do have a teenager at home.
I never really thought of that. I never really, thought about those things until you said that. So
kids sleeping over on the weekends, I'll have one of these in my medicine cabinet. Or we tell people, do you have anybody at home who's recently had surgery, or an elderly person in your home who has memory issues and is on a prescription opiate. There's all sorts of settings where an opioid overdose could occur. So I think breaking down those barriers too, of this isn't an isolated problem and this isn't just happening to a certain demographic. This could be anyone, anywhere, anytime.
Exactly.
And Narcan needs to be the same.
And that's the one thing that our office tries to educate people on, right? Is that it could be that teenager who buys the pill. It could be the elderly who forgets that they already took their medication.
Mm-hmm.
These are the things that open people's mind to, wow, I never thought of that.
Yeah.
When we do the overdose training within the city departments, those are the big things that I highlight, right? Is that, not kids, I'm a little older, but, people in their 20s and 30s, like going out on the weekend, having a couple of drinks and then decided, oh, I'm going to sniff a line of cocaine.
Yeah.
They're not getting cocaine and they're overdosing and dying because they think they're getting a different substance. Even kids who go out and, they want to take ecstasy or these other, club drugs, it's in them too,
Exactly.
So it's really opening people's mind to say, wow.
Yes.
It's so true. The other thing, like, as we're talking, you start thinking about you going into a business and these business owners are like, well, my employees, like, nobody, everybody's good here. But you never know who's struggling. You never know who could be struggling.
Right.
Like you said, you could have somebody that had a knee surgery and were prescribed opioids. And then it just, it spiraled from there. But your boss doesn't know that. And somebody could come to work who's struggling and something could happen on the job. Like it's everywhere.
Right.
Everywhere.
And it's the people who use substances recreationally too. Like every once in a while, they want to have a little extra fun or whatever. And or college kids who think that they're getting Adderall so they can stay up and study and do well and be successful are getting fentanyl.
Yeah.
Exactly.
College and high school age kids, when we come across them, we always tell them, if you're going to festivals, if you're going to concerts, if you know people who are using these festival drugs, you have a chance of being exposed to fentanyl. So we're always trying to, drive that home too and just educate people that it's not as small as you think it is. This is everywhere, unfortunately.
Exactly. And that's literally why we're having these conversations, so that people understand that it isn't just one demographic of people that are homeless on the street.
That's right.
Shooting drugs.
That is right.
I think that's where the business to business model is so important, because we're not assuming that this can only happen in one place, in one area. And there's been places where, to be honest, we've gone on foot and driven around. And when we were first starting this, there'd be, a bigger department store somewhere that we thought, there might be barriers to management and getting in there. And you can never know. There was a department store. We said, maybe we'll circle back. That looks like it could be difficult to get into. And they had an overdose in the bathroom about a week later, and we ended up training them. But you just really can't discriminate. As many places as we can put Narcan, it's necessary.
Even we have learned a lot just doing things like that and kind of looking and being like, oh, they're probably low on the list, so maybe we'll circle back. And then a week later, there's an overdose where you least expect it. And I think that's really important for people to know, that it can happen in any type of business at any time. You could have an employee, a customer. There's so many scenarios that people could come into your business or be employed by your business, and you could be in a situation where something happens and you're not prepared.
And that's why, Narcan should be like a first aid kit in your business.
Absolutely.
It's a life-saving medication, and like we said, it can happen to anyone. So we really need to be mindful of that and get it out there as much as humanly possible, so everybody has access to it, just like if you would carry an EpiPen.
Exactly.
You were diabetic.
That was an example we used often to kind of give an analogy of this is how you're acting. We would tell people, keep it with the first aid kit. A lot of our education too, and a lot of the stigma, I think, was around people being anxious to use it because they didn't want to be sued or be liable or go to court. So that was a huge piece of this program too, was educating the community about Good Samaritan laws and letting them know that if you administer Narcan in good faith, you are not going to be liable or sued. That was one of the bigger misconceptions I think we saw, because often we train people and talk to them and they would say, that's amazing, but we're going to take a hands-off approach. So a lot of our explanation became, this Narcan kit is really your bridge for EMS to arrive and to keep this person awake and breathing and alert to go receive treatment. And when we started explaining it like that, it made a lot more sense to people. They're like, oh, this is why I would intervene versus waiting for EMS. It's to buy this person more time, a better chance at recovery and at
Survival.
treatment. Yeah, survival. Yep. That was a big barrier we faced.
It was. And it's like when we started to say, just, and it does look like a little first aid kit that we give out. So we just started saying, put it with your first aid kit. If a customer fell down in your store and bumped his head and you gave them a Band-Aid, like, just put it where everything else is and think of it that way. If hopefully we tell everybody, we hope you never have to use it. But you don't ever want to be in a situation where, you're in a business and you're like, oh, those nurses came in and we said no.
Yeah.
Yeah.
And here we are.
That's powerful. It really is. What about the other side? Were there moments where you saw real openness or change during these trainings?
Absolutely.
Absolutely.
All the time. All the time.
In the places you'd least expect it, sometimes there would be a business for like, oh, does the H&R Block really want a training right now? And we go in and have one of the most receptive audiences. And I think one of the things we were most impressed by was just the how receptive everybody was.
Right. And people sharing their stories. And just, we've been doing this for a while now, so we know it's everywhere. But even people, we are surprised sometimes, like, by people saying, it's like, I had a son overdose. I had a family member, my mother, or something, and it feels good to be able to share your story with somebody that's we're coming in and we're telling you this is okay. Yep. This is okay. And the amount of stories that we got were.
Yeah. On multiple occasions, if we completed a training, somebody would say, I lost a parent to an overdose, or if I had Narcan, I could have prevented an overdose. A lot more firsthand experience with the effects of opioids than we expected to encounter. But there were really beautiful moments throughout this. For instance, something that comes to mind, we were doing a training in a pawn shop one afternoon, and we had 2 employees, and they were wonderful, and we were doing the training, and we were kind of trying to wrap it up because there were a couple customers waiting. And so we turned around, we're like, oh, we're so sorry, just a couple more minutes. And these customers actually said, no, we're listening in. And we'd like you guys to know that we're in active recovery and you have no idea, or in recovery, and you have no idea what this means to us. And we were able to connect with them and actually give them information about treatment resources and different connections to care. So you never know where you're going to be talking about it, and who needs to hear, who you need to connect with. So this is really just more so about even training on the Narcan, just putting feelers into the community, educating the community, and making connections.
And that's what it's all about is, recovery is just connection. And we have to meet people where they're at, because, we are not God. Who are we to judge anyone, right? Everybody who is in recovery, who is still using substances, who is homeless on the street, like, all those people have a story.
Yeah.
We all have a story, and everybody is affected by this in one way or another, whether it's a coworker, colleague, a friend, a family member, like, it's everywhere. So we have to start talking more about this and being open, and it's okay to feel safe. Like, people felt safe to talk to you about their personal life because you were non-judgmental in that moment. They knew you were trying to help, so they felt safe.
I think too, we were non-judgmental about people's questions that they had for us. Something that we came across a lot was people saying, Narcan enables enables the addiction. And that is a common misconception. And we did hear that often. And we we definitely didn't have this answer at the beginning of the program. But as we kept hearing this, our response became, there's no hope of treatment unless they have access to Narcan. There is no treatment if you overdose.
Exactly.
And that's what people need to know. Maybe somebody needs, Narcan 7 times. And then on the 8th time, that's when they decide they want to seek treatment and get sober. And, who are we to judge and say? But I think we were able to dispel that narrative a little bit too.
Definitely.
We're really offering people a chance at recovery.
And when people start thinking that it enables, you kind of have to think of it like, and I always thought about this as when I was a nurse and I was caring for patients, I would care for that patient like they were my family member. Like, what if this was my mom in this bed, or and that type of scenario works in this situation as well. Would you think the same way if you were talking about your family member?
Yes.
Like that, if Narcan saved your family member 6 times before your family member said, okay, I'm ready, how would you feel about that? And that's very powerful, because then people say, oh, wait, well, if this was my sister, my brother, I would certainly want somebody to have this available to save their life and give them another chance at recovery.
And you can't have a chance at recovery if you're dead.
That's right.
And sometimes, people who are actively using substance on a regular, they don't want Narcan.
Right.
They're not looking, going, oh, well, if I overdose, someone can just hit me with Narcan and I'll be fine. No, they really don't want that. We're now talking about compassionate overdose response, right?
Mm-hmm.
So, big pharma is coming up with these new stronger doses of Narcan that, is higher in milligrams. But what they're seeing is that it is putting folks in precipitated withdrawal.
Mm-hmm.
So, extreme.
They're using.
Yes. So, because they're giving it more and more. The regular dose, the 0.4 milligrams, is sufficient enough to help somebody before EMTs get there. And you have 2 doses. Most kits have 2 doses. So, you have a chance after 2 minutes to give another dose.
Exactly.
And that should be it. By that time, EMT should be there anyway by you administer the second dose by the time.
Mm-hmm. Yep. That's why we always tell people each kit has 2 doses. It's a short-acting medication. And we tell them the kit is used for exactly that. Always initiate a 911 call. And this will bridge the gap between waiting for EMS.
Right. The other thing, I just want to speak real quick on what we were just talking about before. It's like, with that stigma of Narcan, or it's gonna enable people to use, and everybody that has substance use disorder, they have a story. They didn't say, hey, I want to have substance use disorder today. Like, there's things leading up to how that person got there. Nobody chooses this as a life, so people need second chances in every aspect of life. That's just, I think it's huge to know that people don't walk out and say, hey, I want to have substance use disorder today. Like, that's not how it happens.
Well, the problem is that, all these treatment centers and recovery services, they're treating the symptom.
Mm-hmm.
The drugs are a symptom
right.
of the rooted core trauma, unhealed trauma, poverty, abandonment. Like, there is pain and trauma there. And that's what we got to work on, is getting to that root and helping people to address the real cause of their substance use disorder.
Exactly.
Because drugs are, we all have coping mechanisms. We all have vices. Mm-hmm. And we're looking to get relief. It comes down to, we just want relief.
Right.
And from whatever pain that we're experiencing, grief, whatever. And everybody uses something, whether it's coffee, cigarettes, drugs,
alcohol.
Right.
Alcohol is so acceptable, and it's the most harmful drug out there. And we're going to liquor stores who are fighting us to not have Narcan in their establishments.
Right.
but they're selling the most deadliest drug out there.
Right.
So it's just like, it blows my mind to see like what's acceptable and what's not.
Right.
It's so true.
It's so true. And we've had that conversation on many occasions about, well, you have a drink, and that's just perfectly acceptable. Or you go out and have a couple drinks, you get in your car, you drive, like, all of these things are so harmful.
You're impaired. And
Yeah.
people who use opiates, they're impaired, right? But alcohol is so damaging, and like, not that opiates isn't.
Right.
I mean, they all can be harmful if you misuse them.
Right.
But anything can be harmful if we misuse them. I could, if I'm watching too much Netflix or I'm eating too many cupcakes, like that can be harmful too. So, like, when we catch ourselves judging the folks that are really caught up in a cycle, right? Because it's just a cycle. It's like a loop it's like a mental loop in our head that just keeps going.
Well, there's always some precipitating factor, whether that's, mental health or trauma or a surgery. There's always some type of precipitating factor. And I think that anybody who has judgment about opioids, like you said, everybody has their vices. And if you're holding judgment about opioids, just be lucky that you never came across them, because the thing about opioids, they don't discriminate. Whatever your reason for taking them was, if you have taken an opioid, you could be addicted. So I think that's important to realize too. This isn't a certain type of person, or it happens to one person. Any scenario that you're taking an opioid, this can happen. And, we've had conversations with people who said 5 years ago, I wouldn't have spoken with you. But that was before I had surgery, and I ended up needing to go to treatment for.
Exactly.
Yeah. We've heard more stories like that, because I think people have this perception that, you see somebody on the street or whatever, that's, that it was a choice, for one thing. And another thing is you're not living in someone else's shoes. We worked in ICU for many, many years, and it's heartbreaking. You have people from every walk of life come into that ICU, and we've had parents bring, with children, police officers, school superintendents, teachers. Like, these are, what people would say, like, quote unquote, these are good families, or it does not discriminate, and we can't say that enough.
And that's why conversations like this are so important, because even I'm 30 and when I was growing up, there wasn't a conversation around how addictive opioids are. At least to teenagers, young adults growing up today, we're telling them this is highly addictive. If you experiment with this, if you play around with this, you're risking your life and you're risking addiction. And even 15, 20 years ago, we didn't have that knowledge. So I think that's important too, to have that conversation, let people know if you start, be prepared. And even when we do youth education programs, we tell them there's a safe time and a safe place, but if you're ever being prescribed an opiate, there needs to be an exit plan, a taper off plan. You don't stay on them prolonged, and you always need to approach them and use them with caution and know what you're getting yourself into, which I think even that is so different than it was just a short time ago.
Oh yeah, we never talked about this stuff, especially like, it was taboo. Yes, all taboo. Until people started dying.
Yes.
Yeah, and then people woke up and said, oh, what is this problem we're experiencing? But this has been going on for many, many years. It's just the drug supply today compared to 20 years ago is completely different. There was no fentanyl on the street 10, 15 years ago. It was heroin.
Yeah.
And it was safer. I hate to say it, but it was safer back then. There wasn't so many overdoses. People still overdosed, but there wasn't the numbers we're seeing in today's day and age.
Right. And there was, not as much of the element of poisoning like there is now, where it's hidden in substances where people don't expect it.
Yeah, like, all these pressed pills. That's what
Yeah.
we're coming up against. They're pressing them and selling them as ecstasy, as Adderall, as Xanax,
And they're
as perk.
indiscernible. We show our students, we will pull up pictures side by side of 2 Adderalls and say, tell us what's the street drug and what is from a pharmacy. And of course they can't because we can't.
'Cause
They
we can't.
searched it by orange round pill with the number 30. It would show you on Google, this is an Adderall.
Yep.
And this is, something people need to be aware of.
Right.
I think that's something that I think that has been the most shocking, I think, to people that we talk to a lot of times is like, you're like, wait, what? Like you're a nurse and you can't tell the difference? We cannot tell the difference. Never mind these kids. And the fact that these vape cartridges now, the marijuana vape cartridges, and people don't understand that fentanyl is getting into those, which is really scary because kids smoke weed, and they think it's not harmful. But, and then oh, well, you can go get it, but they're not 21. So
Right.
there's still a lot of teenagers that are buying marijuana from the street and not from a dispensary. And it's really scary.
We had a disturbing, somebody had shared photos with us of things they seized, and they were black market marijuana, not from dispensaries, but they were packaged in dispensary packaging. And there were 11 states throughout the country where they found those type of marijuana carts laced with fentanyl, and they were black market. So that wasn't specifically in Massachusetts, but they're selling them around in Massachusetts.
And it's only a matter of time.
It's just a matter of time.
And if you're a kid, you see it's wrapped in packaging and cardboard, you're thinking, oh, my friend's older brother bought this at the store and is perfectly safe.
They're doing the same thing with the marijuana and the things they sell at the dispensary. They're now copying all of the packaging from the dispensaries, and so you cannot tell. You cannot tell. So
the only way you can tell, this is a trick with the pressed pills, is if you rub it. If there's powder on your hand, it's fake. If nothing comes off and it has the coating over it, it most likely
That's
is from
a great
pharmacy.
tip.
Yeah, and the consistency of the pill too. If you crush it,
Yeah, crumbly.
That's a really great tip to share.
Yeah, well, this has been a great conversation, but Narcan. So let me ask you, how do you see outreach like this directly fighting stigma?
I think in all the ways we talked about, I think just having open conversations and talking about it is the only way through. And like we said, 99% of people we spoke to were nothing but receptive. If they had any, catch-ups, it was not from a place of judgment, but from a lack of education. I think one instance where I can say maybe we heard something, just straight up ignorant.
Yeah, nuts and ice.
Yeah, there's one situation I can think of, but otherwise I truly think that any question or any pushback was just truly rooted in a lack of education. So I think one of the biggest things we can do is just talk about Good Samaritan laws and let people know that if you're ever in a situation where you suspect an overdose, so somebody has slowed breathing, blue lips, pinpoint pupils, they're seeming unconscious, and this is for kids at festivals, concerts, anywhere you might be, if you're at a bar and you see this, to be able to respond with Narcan is life-saving. And I think we used the analogy of a fire extinguisher. If you could extinguish a fire, why wouldn't you? If you could save a life, why wouldn't you? And if it's as easy as a nasal spray, and that's another misconception. A lot of people do not realize that Narcan is simply a nasal spray.
And it's so easy.
So easy. As easy as giving allergy medication. Exactly. So that was also a misconception because some people did think it was EpiPen style. And they're like, I don't want to inject anyone. I'm scared of blood and all that.
Exactly. Yeah, we had a lot of people, they're like, that's it? I'm like, that's it.
It's one little tap and it goes up, it gets into the membranes, it knocks the opiates off the receptors, and then the Narcan sits on those receptors. But what people need to know is that it only lasts 90 minutes. So you want to make sure that they go to the hospital, because when you wake up from an overdose, you don't realize you overdosed. You wake up like, what are all these people doing around me?
Yep.
What is going on? Like, I'm fine. And they want to walk away.
Yeah, that's part of our training.
Yes.
A big part of the training is explaining that to people, that it's very short acting. So this isn't going to...
Because once that Narcan wears off, those opiates can go right back on those receptors, and you can go into another overdose.
Yeah. I think at the onset of this program, too, we were nervous about if we distributed so much Narcan into the community, would we be preventing people from calling 911 and going to seek treatment if they did overdose in the community? And so that's been an important part of our training, too, where the medication is short acting. With 2 doses of Narcan, you cannot guarantee that somebody will reverse an overdose. Right. So you are always initiating a 911 call. So I think that's good, where we give 2 kits to bridge that 911 call, but we're not giving enough that somebody could take a kit and use at home and get into trouble. And also, I think something I noticed was we have the nalox boxes around town, which are amazing, and people can access those. I think this program helps to give better use to those too, because now people see those on the street and say, I know how to use that. I know how to respond. Let me grab one of these and take it home.
Exactly.
So it also helps on that front to just educate people about where Narcan is in the community, how you could find it, and how you can use it to save a life.
Yeah. So, and just to let our audience know, we have 9 Narcan boxes throughout the community.
I didn't know that many now.
9, and each week we go and replenish them. And I don't have the number off the top of my head how many we have already given out. It's been a little over a year that we've had them up, since May of 2024. And we've given out hundreds, like 500 doses have been distributed throughout the community. And now with the businesses jumping on board with this, like, there's no reason anyone shouldn't have access to this life-saving medication.
Right. And that initiative has been so great, too, because a lot of these businesses, when we made first contact and said, have you heard of naloxone or Narcan? They say, not until I saw the box that went in across the street over there, and then I looked it up. So you guys are doing a really great job of just educating the community about Narcan and how to use it and how to respond.
And visibility is huge. Like, that's what creates normalcy. When you're seeing this now in the community, and you're like, oh, okay, like this is a good thing. This is a good thing.
I've had pushback from community members when those boxes first went up, and one guy had said to me, I don't want this here. And he said, what about the kids? If the kids get at it, something could happen. And I said to him, this is not going to affect anybody. It's like you're spraying water up your nose. If you don't have opiates in your system, it will do nothing. It only works on opiates. So it is the safest medication as well. If a kid was playing with it, like it would wet them.
Right. Yes. And it can be used on children. It can be, there's no age limit. Exactly. So that's what people don't understand.
That's an important part of our training.
It is a huge part.
That piece. And we also always let people know that if you're ever in a scenario where, say, for instance, somebody's having a diabetic coma or a stroke, some medical emergency where the symptoms could mimic an overdose, or you're just not sure, you are never, ever going to harm somebody by giving Narcan in doubt. When in doubt, always administer. And that's safe for all ages, all medical conditions, because the Narcan fills that opioid receptor. The only time you're going to have an effect from Narcan is if you have opioids in your body.
Right. And that those have been questions, that have come up with community members, that they're concerned, like, how do you know when to give it? How do you just give it?
Just give it.
Right.
Just give it. We are lucky enough in this state to be able to have access to this for free.
Right.
Free, right? So that, like, as many people can access it as humanly possible. Everyone should have one in their pocketbook. Everyone should have one in their backpack.
Yes.
Absolutely.
As we've done this opioid work and research, evidence-based programs and what works and what moves the needle, what we really found looking across the country, like a county next to another county, the overdose rates could be, not comparable at all. One county's through the roof and one county's pretty level. And what we learned through research was the difference was Narcan, access to Narcan and reversal overdose, or reversal overdose reversal agents. That really is what moves the needle, is having Narcan available. And
we're still seeing stigma in other communities that aren't willing to try a business initiative
Right.
or have Narcan boxes or even educate their community on it. And that is like stigma, right?
It is.
Yeah.
it is.
It is. Well, we're hoping, I mean, this program has been so successful here, and so well received that we're hoping people talk. Because like
Exactly.
you said, this is what gets it out there. Education, talking. You talked about stigma, and we really get through to people where they're in person. We're nurses. You know, we have experience. We've had experience in the hospital with overdose. And I think it's once you get talking, you just have to get the person in front of you to have
To
that
listen,
conversation.
actually listen.
And like I said, 99% of the time when we can have that conversation, the light bulb goes off in that person's head that's listening to us. Like, oh, well, this could happen. And this isn't what I thought it was. So that's wonderful change, you know?
And I think with a lot of public health work, we see the same players a lot, or the same community members coming together, knowing what resources are available. But by doing the business-to-business approach, we're spreading that through the community. So people who might otherwise not have heard about, for instance, your resource day or different programs available, now have access to infrastructure they didn't know existed before.
Well, even when I've had events, I've had, after the fact, I've had community members come up to, I didn't know anything about it, and it's like, okay, how can we get the messaging out there for, the events that we do, the resources that we have, the help we can offer,
Right.
Like we want the community to know that, like, there are these services, but when you're not in it, right, when you don't have a person that you're worried about, that's using drugs, you're not going to seek our services. You're not even, but just to know, if God forbid down the road your child comes home from school and is caught up in something, you want to know what's out there, especially if you have teenagers. Like our office, you should call and inquire or look on our website and see what we offer and, be proactive so that you can have those conversations with your kids. Like, hey, I heard them talking, the public health department, about this medication and about, drugs that aren't safe. The drug supply is literally poisoned, and not just with fentanyl, with other substances that are like built for animals, like tranquilizers that like are not for human consumption. And they're also causing these open, nasty sores and wounds on people's body too, which is then they're having to go to the hospital to take care of that, and then possibly antibiotics, and like it's just like a vicious cycle.
I think, like when you say events, I think the most surprising thing was we started to get the word out there, and one of the other communities that we work in, and you guys do a lot of events as well, but we literally started setting up shop with our Narcan table at rabies clinics, park days, all kinds of things. And I remember that first rabies clinic we did, and we were like, get out of here. We were out of Narcan by the end of the rabies clinic.
Wow.
And that's just from people going, the dog, cat getting their shot. We're down the other end of the table. They stopped. They're like, hey, what do you guys do? What is this? What is this? And you have these conversations, and the next thing you know, we've given out 100 doses of Narcan at a rabies clinic with an education pamphlet, and now you have 100 more people.
And these events are so eye-opening too, because these are also where you realize that you'll give somebody a training and give them a Narcan, and at the end they'll say, I wish I had this when my son overdosed. Or, that shows you the vastness of
Absolutely.
what we're dealing with here, because there's so many people. You think, oh, do they have, any skin in this game? Does this affect them directly? More than you could imagine, way more than you could imagine.
Speaking of doses, right, of Narcan,
Yeah.
how many, if you had to guess, how many doses have you given out? First of all, how many businesses have you trained, educated, and gave them naloxone?
What are we at? 100 and 180.
Yes, so I believe we're at about 170 total businesses trained, over 350 doses of Narcan put into the community. And also I should mention that we provide every business with 2 doses, but if there's any employee in the business who's interested in taking Narcan to have on hand, we give that to them too. So it is probably closer to 450 doses of Narcan into the community. We've trained over 300 employees in the community. And 175 businesses. So that is 175 points of access where if they come across somebody in need of services, they now know who to call, who to reach out to. Everybody who received a kit, they have the contact information for the SUDI office and instructions to call with any outreach questions or replacements. So basically, any of these businesses, 175 new points of access, where if they know somebody's in need, they know where to go.
Right. On top of that, though, like Carrie was saying, when we're in a business and we're doing our training, there's customers in the business. So we've had so many people. I mean, we've been in nail salons and whatever, and we'll be leaving and the customer will stand up and they'll say, that was so great, I can't believe you guys are out doing this, or I didn't know that, or because they're within earshot. So we keep metrics on how many people we see, but we don't really have the number is much higher of people that have interacted with us and heard our training.
Passerby training,
exactly.
And so you're giving it to more community members, and so this city should be filled with Narcan. And everybody should know how to get it, where to get it, and
exactly
how to use it.
And a lot of overdoses, have taken places at businesses. That's why we wanted to start this initiative.
Right.
They've happened at multiple Dunkin' Donuts. And I know Dunkin' Donuts is hard to get into because of corporate and whatever.
We did it, though.
You did it. And you got actual employees to say, I'll take it even if they don't, And that is amazing to me, that it just gets me so excited to know how many businesses now have it in their establishments and how open people have been, because I was nervous that you were going to get a lot of pushback. So to know that most people are receptive and they're educated now, and now they can teach someone else and someone else.
Right.
And let's hope that everybody carries it on them.
Exactly.
Right. Well, I'll tell you a funny story. It's just a personal story, but so obviously my kids know what I do, and they've all been given Narcan to take to college and wherever else. So my oldest is out of school. He was going to Canada to visit a friend, and he has Narcan in his car. And the border agent was like, this is another stigma, Oh, why are you carrying Narcan? You must use drugs. And I was so proud of him, because he's like, my mom does outreach. And he told the whole story to the Border Patrol agent.
That's amazing.
And at the end of it, the Border Patrol, he was like, wow, that's really great. And that's just one thing, but it's like somebody tells somebody, somebody else tells somebody, somebody else tells somebody. And you're like, okay, that makes sense, So yeah, that was a really, really good story.
That's really cool. Yeah. And I have some cool stories too of just people that just didn't have any idea on what this was all about, and was too nervous and didn't want to know what it was about.
Right.
But once you explain it to them and they're like, oh, wow, that makes so much sense. Oh, that's great.
Yep.
And I'm just thrilled that our community has access everywhere, and the overdoses are reducing.
Yes. I think the community is doing an amazing job, and this upcoming generation, they know so much more than we did.
Yeah.
I just worked a community event the other day, and a young girl came up to my table and she said, I actually know how to use these, but I'm going to take a couple because my friends could make better decisions. And
Yeah.
I'm like,
See?
look at that. Like,
Right.
that's exactly, you know what? Yes,
Yeah.
you're in college, you're going to parties. People make mistakes.
Yeah.
People do, you know, or
People are curious.
people are curious.
Mhm.
People take things that are laced. They don't know. So every place, every time, that's what we can do. And that's what we're trying to do.
And the working opioid groups in the different cities and towns is, I mean, another thing, with stigma, we work with the police and we work with fire. You know what I mean? And now we're all working together. So if like that situation that my son was in, like if somebody gets pulled over and they have Narcan in their vehicle, it's not necessarily saying that, that's they're using drugs or
Right.
that's a bad thing. And since we've been able to connect with police and fire, and you're reducing that stigma, and it's making more and more sense to everybody that's involved in the process. So it's been really great.
It has. We've been lucky, and I think one of the best things was just how well received it was by the community, and it just makes you feel hopeful that there's less judgment than we think, and where there is stigma, I think so much of it is rooted in misunderstanding versus
And fear.
fear. Yep, but we found there was a lot less pushback or negative feedback than we expected. We were so pleasantly surprised by how much the community wanted to engage and learn and be a part of this.
Which is a huge positive step in the right direction, and saying, well, if people are engaging here and in the other towns, then this is rolling forward.
And it will become a thing, right? Other communities will be like, wow, look what they're doing in Revere. Let's try that out. And that's the hope, right? Is that
Right.
the more we shine light on the stigma and in the misunderstanding of what this is all about and what we're trying to do, we're trying to shine light on the fact that these are human beings, these are people's lives.
Yep.
We've lost over 70,000 Massachusetts residents
Crazy.
in a couple of years. Like, that's crazy.
Awful.
And these are people who had potential.
Sisters, brothers.
Yes, they had potential. They had life in them. They, whatever.
Right.
It's just like they're not here possibly because of the stigma. And
Right.
Who's to say if a dose of Narcan would have?
and the other big thing is like people who do have substance use disorder have a lot of shame around that. So they don't tell people they're going to use. If they have, a slip or something, and they're using by themselves, shutting the door, locking it. And that is what we got to reduce, is like allowing people to be okay with saying, like, I'm going to use, I just want to be safe.
Right.
And that's why we have Safe Spot, right? It's an 800 number. You can call you and let the people know, listen, I'm going to use, I don't want to tell my friends and family because they'll be disappointed or mad at me, but I want to let you know I'm going to use. And they literally have your location.
Yep.
And if you don't check back in 5 minutes, they send EMTs to you.
Right.
So like, there are so many resources for people who are afraid to talk about their drug use,
Right.
who don't want to share it because of fear of judgment. And, there are safer ways they can use it. Our whole goal is to meet people where they're at. So if you're at a place where like, hey, I like using, this is what I do, this is my life, and I'm okay with it, whatever scenario you're in, we'll support that. We're not going to tell you have to get off drugs. We're not going to tell you have to go to treatment. We're not going to force our beliefs onto you. And that's what happens in the treatment world is most of the people that work in treatment are in recovery, right? And they push their own personal beliefs onto folks that walk through the door that aren't ready to hear what they have to say.
Right.
Like, just love, support, connection. That's it. Like, keep your personal opinions to yourself.
Well, that's so key what you said. They're not ready.
Right.
So it sounds funny to like make this kind of comparison, but you think about, nobody's a perfect person. And how many times have you done the same thing over and over again? And you're like, why do I keep doing that? Like, kind of like, okay, so say you want to lose 10 pounds, and then the next day or two, you're at McDonald's or something like that. How many times have you done that? No, you have to be ready. And it does sound like a crazy comparison because it's not, but it's just kind of a real life comparison to how many times have you had to do something to make that change in your life, whatever that may be. It's not instant.
Well, don't forget you got a point in your finger, you got 3 pointing back at
you. That's right.
That's you're projecting your shit to a person who is having a struggle.
That's right.
You think they can just snap out of it.
Yeah. And like I think I said earlier, people who haven't come across opioids in that capacity, it's luck. You're lucky that you haven't, been in that scenario.
Yeah, because everyone's going to be affected by this. Everyone.
Right. Yeah, it's literal luck at this point.
Hopefully in another 20 years, right? What we're talking about will be so norm is the hope is that like people like you that are passionate about helping other people stay alive long enough to figure out what their next move or step is.
Yeah.
And being there for their friends and family, like this is going to be normalized. That's the hope.
Yeah, right. Sometimes harm reduction is the most compassionate thing that you can do.
It is, right? Because I know if somebody tells me, hey, don't drive through that red light.
Yep.
Just because they told me not to, I want to drive through it.
Of course.
Like that's human, human behavior.
Especially teenagers.
Oh my God, yes.
Right.
And some parents are, very controlling and helicopter parents and because of their own fears and biases.
Right.
And then you have other parents who are like, do what you want. And, so and not to say that your parenting skill is right or wrong.
No.
It's just everyone's different.
Right. Well,
it doesn't discriminate.
It doesn't.
Strict parent, your kid might want to go experiment. Lax parents, they might be out doing who knows what.
When we deal with parents, when we have people come up to tables and things like that, it's, we always try to say, the thing you don't want to say is not my kid.
Exactly.
Okay. Yeah. Because again, I can't tell you how many people, good grades, sports, whatever, the kids you think that will never happen to, it happens all the time. So you don't want to be that parent that says, not my kid, and then you're not prepared for a situation that you didn't see coming.
Exactly.
So, and we've all been there, like teenagers are stupid. They make mistakes.
Exactly. They're learning. They're trying to learn out where they belong in the
Doesn't
world.
mean you're a bad parent because you have Narcan in the house in case something happens.
Exactly. Yeah. And I think all parents of teenagers should have it in their house.
100%.
During this program, we talked about this story, but I had seen a news clip, and there was a family. They were having a dinner party downstairs, and their teenage 16-year-old daughter was up in her bedroom with a friend. And at some point in the night, they said, it's been quiet up there. They went upstairs to look, and one of the girls had passed away and overdosed, and one of the girls was still breathing. And they had taken Xanax, what they thought
was Xanax.
And they, the daughter whose parents' home it was, overdosed in the home, and her friend lived. But this happened. Their parents were downstairs having a dinner party.
Right.
You just never know. It does not hurt to have it in your medicine cabinet or in the glove box of your car. You never know when you can save a life.
And the other thing is for people who do like to use substances or doesn't necessarily have a substance use disorder,
right,
is we offer fentanyl test strips.
Yes.
So if you are buying Adderall off the street and you're not sure, you can test it to make sure the fentanyl's in there.
Yep.
Absolutely. And again, people see that as you're enabling somebody. But you know what? You're enabling someone to not die.
Exactly.
Is what you're doing. If you want to knock it down to the simplest thing.
Right.
And again, it takes people time to get there.
Exactly.
And they need to be able to get there.
Mm-hmm.
You can't get there if they're not here.
And if they don't have these life-saving resources, right, they're not gonna make it. So we have a better shot of saving a lot more lives, having access to this, having it everywhere. Like every human, I believe, should have it on them. And I know I've had many conversations with people who just don't get it and don't believe in it and think that it's enabling. And, I just try to explain to them, like, this is human connection. Like, this is, you might not believe that this is safe, but wouldn't you want somebody to save your life if
Right.
you had an accidental overdose, because most of the overdoses are accidental.
Mhm.
Right.
There are people thinking they're getting other substances.
Yep.
There are people, elderly who, like you said, forget that they took their meds already and they take them again.
Right.
We just had a couple of overdoses at some of the over 60 buildings.
That's a
These
lot.
are older people that are
That's a lot.
overdosing.
Yeah.
68 years old, 56 years old. It just,
Right.
it does not matter.
No, it really doesn't. It is. I have seen recently people who had surgery that they give it to you with your prescription when you
They do now, yeah.
yes, which is amazing. But even that, I think it was like $70 or somewhere around there.
It used
So
to be 90.
yeah, it's so important for people to know too that if you're looking for Narcan, a lot of towns, including Revere or cities, are community naloxone partners, and you can get Narcan, or you can go to the nalox boxes and get it. But we hope to have it always accessible easily.
And if they don't give that to you, because they don't always give it, and if they don't give that to your family member, if you're prescribed an opioid, ask for it.
Yeah, because most insurances cover it. I think
Yes.
you might have to pay a copay.
Mhm.
But
Yeah.
if you didn't, it's $90 for this. And we
Right.
give it out for free.
Exactly.
Come
So-
get it. And
yeah.
if you ever do use naloxone, which is Narcan, I know we go back and forth.
Yep.
If you ever do use it, please call and tell us so we can replace it
Right.
and we can know that it worked to save somebody's life.
Exactly. And that was a part of our business initiative too, was letting them know if they ever administer, we'll replenish and
Mhm.
to just reach out.
Exactly.
Right.
That's amazing. Ugh, this was so great. Thank you so much for sharing your experiences and your heart. Your work, the work you're doing isn't just about overdose prevention. It's about creating community where people feel safe, supported, and seen. For our listeners, remember, stigma kills. Compassion saves lives. If you want Narcan training for your workplace or you just want to learn more about it, please reach out to us. This has been the Shame on Stigma podcast. Until next time, keep talking, keep challenging, and keep showing up with love. Thank you all.
Thanks, Carrie Ann.
You.